This is our topic tonight, COVID, kids, and back to school. So we are going to jump into all sorts of information about that, and we're really excited that you chose to join us tonight. So my name is Sierra Bragan. I am the owner and founder of Miami Mom Collective. We are Miami's premier parenting resource and community, and we exist to encourage, equip, and empower families. We do that through resources on all of our platforms, as well as hosting events for moms and families, such as this amazing webinar that we have partnered with UHealth Jackson Children's Care to bring to you. So I believe we started these when COVID hit. The amazing team at Jackson said, let's take it virtual. And now here we are, still going virtual, but able to bring this important resource to you. So thankful for the means of technology to do that tonight. I want to bring to your attention a couple points just about the UHealth Jackson Children's Care system. You may not know, but the pediatric emergency rooms at Holtz Children's Hospital, as well as Jackson North, are available to you 24/7, and they're all staffed with board certified pediatric emergency medicine specialists. So that means parents and kids are getting access to every pediatric subspecialist, not only from Children's, from Holtz, but also from the University of Miami Health System, as well as Jackson Health System. So tons of resources available to you. Hope you never need them, but if you do, you can also know that Holtz Children's Hospital is a 24-hour kids-only emergency room. And so I always love to bring attention to that, especially in these days. Unfortunately, with COVID at our hands, to take our children to an adult emergency room just is scary in general, but to know that Holtz has a 24-hour kids-only emergency room is just really important, a great resource for you. So also note that at Holtz Children's, the doctors and the nurses are all certified in pediatric advanced life support. So you are really getting the best of the best care. So I hope this school year, no one needs the ER, but again, if you do, just want to draw your attention to that. So I am excited to dive right in. We have so much to cover. Please help me virtually, round of applause, welcome Superintendent Alberto Carvalho. We're so glad that you're with us tonight. Welcome.
Thank you so much. It's a pleasure to be with you. Thank you so much for the invitation. And this is an opportunity that I never waste, and an opportunity to not only chat with experts, but also to connect with the community. Well, so I'm delighted to be here with you tonight.
Well, we are so thankful. And I mentioned this to him before we jumped on live with you guys, but I just want to say it corporately, just thank you. This is a very hard season for anyone to be in leadership. There's no guidebook for how to navigate through a pandemic, how to lead an entire school system. And so we just want to say thank you, not only for being with us tonight, but for your leadership and for navigating the community through this. We appreciate that so much. Well, I want to dive right in. And before we do, I want to tell you a little bit about Superintendent Carvalho. He has served as the superintendent of Miami-Dade County Public Schools, the nation's fourth largest school system, since September 2008. And during his tenure, he's become, Miami-Dade County Public School System has become one of the nation's highest performing urban school systems. I think that's something huge to celebrate. Additionally, he has been widely recognized both locally, nationally, and internationally for his commitments to all children in our community, including homeless students, special needs students, his support of the arts, as well as every aspect of public education. So Dr. Carvalho, again, thank you and welcome. And if we can, let's just dive right in. I'll introduce our other experts in a bit, but can you start by talking to us about the robust menu of summer programming that was offered this year and give us some insights on how that impacted students?
Sure. Thank you so much again for this opportunity. And to make it more meaningful and quite frankly helpful to the viewing and listening audience and interactive, I'll try to make my answers fairly short to cover as much ground as possible.
Perfect.
So yes, look, I think it's fair to say that we as a nation, and certainly in Miami-Dade and across the state, are facing one of the most significant learning loss phenomenon that we have experienced as a country. Because it was the result of a compound effect of the traditional summer loss, but also the learning loss associated, the unfinished learning associated with students, particularly fragile students, who were learning online without the appropriate parental support, or those who were at least to a certain extent, disconnected from learning. Yes, they were connected online, but they were not actively connected to the learning process.
Mm-hmm.
And obviously, those deficits that we're now seeing are not distributed evenly across all sectors of our community. Certainly, students with disabilities, students whose socioeconomic condition is fragile, they live in poverty, students with home insecurity, 9,000 homeless kids in Miami-Dade, 400 of whom live unaccompanied in shelters, and English language learners. So we felt that we needed to provide a very robust summer program, and we did so through Summer 305, which ran for 5 weeks between June 14th and July 30th. And we actually were able to provide an expansive suite of services, allowing students in every grade level to explore, to experience, and excel through very meaningful, academically rigorous, but also fun and engaging learning opportunities. So we had 18 different programs offered both in physical as well as virtual modalities at 179 schools.
Wow.
We partnered with 296 community-based organizations in partnership with the Children's Trust. We cooperated in dozens of academic camps offered outside of our schools. And we address students at all levels, certainly in terms of catching them up in addressing through remediation and acceleration towards the full academic potential of all students, children based on where they were academically speaking, taking into account interim assessments and formative assessments that told us exactly what the proficiency in reading, mathematics, science, et cetera, were, and accelerating them towards their full potential, but simultaneously addressing their social and emotional needs, their mental health, enrichment opportunities, as well as cultural programming for students, exposing them to the arts, to music, et cetera. In all, we were able to provide services to over 75,000 students for 5 weeks, which was quite remarkable. By way of comparison, prior to Summer 305, our summer program usually delivered services to roughly 7,000 students. This was in excess of 10-fold increase of the student population that we provided services during the summer.
Wow. Well, bravo and congratulations. I have to say, sometimes you think, okay, school's out for summer, so everybody's taking a vacation, but Miami-Dade sure wasn't. You guys were working hard. So
teachers are tired, and so are principals, but we recognize the need, and this is not the time to slow it down. It's actually time to accelerate.
That's right. That's great. No summer slide happening for those 75,000. That's incredible. Superintendent Carvalho, so understanding that school begins August 23rd, we've all got that date circled in red on our calendars. Tell us what instructional models are available for students.
So we actually have three different forms of educating children through 2 different models. We're excited to welcome, as you said, every single one of our students to 100% of our schools will be open on August 23rd, welcoming all grade levels. So we expect roughly 350,000 kids to return to us. Wow. And in addition to the so-called traditional schoolhouse model, we will have a virtual modality option available to students through 2 different schools. One is the Miami-Dade Online Academy, which is a pre-K-12 schooling opportunity, which already exists, and it's been in existence for a number of years. We enroll about 300 to 400 students annually, and historically, those have been students of parents who have work-home flexibility, parents who may have, at least themselves or the children may have had some underlying health conditions that made it better for them to learn online, or traveling parents, children who are actors or athletes. This year, we are expanding the virtual option, virtual modality, to another school that has enrolled up until now, brand new school, 1,400 students, and the number keeps climbing. And this is the Miami-Dade Virtual School, pre-K-12 as well. It is a franchised, the Florida virtual school, but the difference is that these teachers who will be operating this school through synchronous and asynchronous interaction with students are Miami-Dade County public school teachers, fully certified and managed by MDCPS. So we're ready to educate kids, physically speaking, through the traditional schoolhouse model or through 2 different virtual modality options: Miami-Dade Online, Miami-Dade Virtual. Miami-Dade Online, fixed attendance based on an enrollment timeline that has already expired. However, parents still have the ability to enroll children in Miami-Dade virtual school all the way to the first day of school, August 23rd.
Okay, great. Yeah, would you elaborate just a little bit on, maybe just for our listeners, the differences between Miami-Dade Online Academy and the Miami-Dade Virtual School again, just so we're clear those two separate.
Sure. So Miami-Dade Virtual School is both a synchronous and asynchronous based on the utilization of Florida's virtual school curriculum,
Okay.
which is basically prepared curriculum that teachers deliver, could be real time, live with students online. And part of the curriculum, the student on a self-paced mode really goes through, meeting the standards and the benchmarks, which are viewed by the teacher online.
Okay.
Miami-Dade Online is a virtual school, but it basically follows Miami-Dade's curriculum rather than Florida Virtual Academy curriculum. And it requires a great deal more interaction with the teacher in a much more synchronous, centered approach, meaning expect the child to really have the 7 hours and 20 minutes pretty much consumed through direct interaction with the teacher, while Miami-Dade Virtual School will have more flexibility, more self-paced. Another way of saying this, it's more for students who have some degree of success managing more autonomous education model.
Gotcha. Great. Oh, that's helpful. Thank you. Okay, let's talk about vaccinations. So are vaccinations required for children ages 12 and older to return into the school buildings?
So I'm so happy you asked me that question, because I know that there are experts in the panel, including Dr. Gwen, and if I didn't say this, I would pay a high price, as I should. We as a public school system require vaccinations, period. And I'm really concerned that people are so fixated, as they should be, on COVID-19 vaccination for those who are eligible 12 and older, that they are forgetting to a certain extent the required immunization for children to attend public school.
That have been for years, right?
Yeah, so MDCPS will continue to encourage all eligible students and employees to get vaccinated against COVID. And I really hope that we continue on this trend in Miami-Dade that is outpacing the rest of the state and the rest of the country, with percentage of eligible individuals who have at least obtained one shot, really at high levels, 70, 80, 90% based on age grouping, compared to much lower percentages across the state and country.
Wow.
So vaccinations are required. However, COVID-19 vaccination is not required, and there are currently legal preventive measures adopted by the state legislative body that prevent us from requiring COVID-19 vaccination. Mm-hmm. However, we are strongly encouraging it. We are considering at this point, quite frankly, financial incentives associated with vaccination of our employees. And we depend on partnerships with the University of Miami, with the Department of Health, for the mobile vaccination units that are available to our students, to our parents, members of the community, and certainly to our workforce. So 2 quick points: COVID-19 not required and not enforced to be required in the state of Florida in any public school, number 1. However, we strongly recommend anyone who is eligible for the vaccination, 12 and older, to be vaccinated. There is compelling scientific, medical validation for the effectiveness of this vaccine. We all know that over 99% of those individuals who are contracting COVID and end up in the hospital are individuals who are not vaccinated. And even if you contract COVID-19 and are vaccinated, the symptoms, the impact, the deleterious conditions that you could face don't exist. So critically important for people to vaccinate. At the same time, second point, I'm really urging parents to ensure that their children's immunization records are accurate and updated. So there is still time, and it does not cost money to have your child immunized for the 21-22 school year.
That's great. Yes, thank you for speaking to that too. I know in previous webinars, our pediatric experts are always saying things are crazy, but don't put off those annual visits for your children and those regular checkups so you can stay up to date on those school required vaccinations. So thank you for that. Let's talk a little bit about social distancing and what measures will be implemented in school. We have, we've had some families asking, what about, lunch setting and how do we navigate all of that? So talk to us about the social distancing at the schools.
Sure. So there are three levels, three types of social distancing depending on the space that's being occupied. So getting to school and leaving school, talking about school buses, right? Mm-hmm. We last year deployed a protocol. And by the way, we take all of our protocols to our medical and public health task force experts, which is a group of distinguished individuals, Dr. Gwen being on that group. And we're really thankful to have that level of expertise at our disposal. But so on school buses, last year we followed a protocol where you would have one single student, one child per bench on the bus. This year, we hope to accomplish that as well, even though we will have a critical mass of students getting on those buses. So masks will be required on buses, and we hope to maintain maximum distance between students as much as one child per bench. In some instances, being perfectly honest, there may be more than one child per bench based on need, but they will be required to wear a mask. In schools, obviously in the hallways, public spaces, they are marked. There are signage in every one of our schools with single hallway directions, and where that is not possible, dividers, and appropriately marked distance markers so that students and adults understand what 6 feet apart means. Inside the classrooms, we're going to try to maintain the 3 feet apart recommended distance by the World Health Organization. And in cafeterias, where obviously students will be taking off their masks to eat, obviously, we will have greater distances between students to ensure that the highest level of health protocols are maintained.
Great, thank you.
One thing, outside, outdoors, during physical education and during breaks that students naturally have, recess, etc., masks are off, and obviously appropriate social distance is maintained. And we hope that kids will run, will exercise, will have fun, but then obviously as they come closer together, that they maintain some degree of social distancing of no less than 3 feet, as would be expected in the classroom.
Thank you. On that note, let's talk about face coverings and masks. Will they be required at schools, and will the district continue to provide them? Tell us about that.
So we have the capacity, based on acquisitions that we made over the past year and a half, to provide the appropriate PPE for any child or employee that needs it. And we're talking about gloves should they want gloves, certainly masks should they need them. We 2 months ago, in consultation with our health and medical expert task force, relaxed the standard. But 2 months ago, the conditions were different. Positivity rates were much lower. We were encouraged by the availability of vaccinations for those 12 and older. And conditions in hospitals, particularly ICU, were significantly different from those that we are now facing. Right. So the protocol was relaxed to a point where we envisioned a mask protocol that would be optional going into the 21-22 school year. Obviously, conditions have changed, and it's sad that, unfortunately, this topic has been, to a certain extent, highly polarized around political pronouncements rather than medically informed and research and scientifically informed protocols. That's disappointing and of grave concern to us. So we are going to go back to our task force of public health and medical experts this Monday the 16th, to probe our experts on a number of different protocols, our recommendations specific to quarantining, specific to contact tracing, utilizing some new technologies and conditions, but also on the issue of masks and the critical question in light of the governor's recent executive order, followed then by the release of 3 emergency rules by the State Board of Education and the Florida Department of Health. I think we need to have this conversation with our medical experts. We certainly hope to be able to craft protocols that will simultaneously ensure full funding of our children's education, even though I think that threat is no longer a legitimate threat to the overall financing of the school system. It's now more of a threat against my salary, and I'm here to tell you what I've said all along. That threat is not going to have any weight whatsoever. It's not going to be a factor that will impact my ability to move forward with a recommendation that makes sense, that is scientifically based, while simultaneously protecting the health and well-being of our students and those who teach them every single day. So we will be making a final decision regarding masks after our Monday, August 16th meeting with our medical experts task force, which is to take place at 4 p.m. I know there's a great deal of anticipation and anxiety about this issue, but look, masks are an important, scientifically proven means of protection alongside a number of other tiered preventive measures, right? And we cannot forget those either. So I'm looking forward to our meeting on Monday, and then shortly after that, making a decision and announcing that decision to our community in advance of obviously the first day of school, which is scheduled to be August 23rd. But what I can tell you at this point is anyone entering schools today is being required to wear a mask, and that means all employees, all visitors, volunteers, etc. Regarding students and what appropriate opt-out provisions would be recommended, that's something that I really want our medical experts to chime in. And that's the most important voice that will inform my decision-making process.
Superintendent Carvalho, I certainly do not envy you, but I'm thankful for you and just your leadership. A lot of decisions ahead, but it's just great to hear. I think a lot of times as parents, we can just, we become mama bear for our children over a number of things, but sometimes we just need to hear, look behind the curtain a little bit and hear what's the process, what's happening to make these decisions. So thank you for being candid and sharing that with us about that meeting on Monday at 4. We'll certainly be thinking about that as those decisions are made. Quickly, I know we may be running out of time here soon. There's so many great questions. I wish we could get to them all, but talk to us about what steps are taken if a student or a staff member tests positive for COVID-19.
Critically important question. So obviously, as a result of improved science and technological advances, and we expect that the quarantining processes will be much more surgical in nature, much more strategic. Instead of quarantining entire classes or departments, the quarantine process will focus more on individuals directly impacted by a potential exposure due to the availability of, better science, better data, and better, more targeted close contact screening protocols. So we expect that the steps will be taken if a staff member tests positive for COVID-19 will be not that different, the steps themselves, from the protocols we followed over the past year and a half. Obviously, quarantining for a certain period of time. And in fact, that's one of the questions we're going to bring to the task force Monday, because there are different perspectives. The State Department of Health has provided a specific chart that provides guidance on the quarantining time period. But there are other recommendations. Florida's recommended quarantining length of time, inclusive of negative test or without test, just relying on symptoms, is different from that of the CDC. And that's one topic that we'll be probing with our task force. And the same will be applicable for students as well.
Mm-hmm. Thank you. I want to see if I could squeeze in a couple more questions. I know we've got two other guests as well, and but we want to squeeze a few more in. If a child must leave the school setting because of a COVID-19 situation, what steps or measures are taken to be sure that they continue to keep the pace of learning?
So students asked at this point, and this is a topic of great importance to me, need to understand that we utilized federal money to install the cameras, high definition cameras in every single teacher's classroom, and every single teacher's classroom has a Promethean board that is interactive technology that allows actually for a student to continue to assist, to continue to participate in class activities. So we are in conversations with the representatives of the teachers union to reach protocols over the next few days specific to that acceptable level of engagement. I think students who are asked to leave the school based on COVID-19 conditions must be provided with access to instructional continuity, utilizing the technology that's available to us. The details of that are still being worked out, but it is important to me that students remain engaged in the learning process and have a reasonable expectation of continuity of education from a distance, considering the technology we currently have. We did this during more difficult times during the pandemic, and I think it's one of the advances for our school system as a result of the pandemic was this explosion of technology available in schools. Right. It cannot go dormant now. So sick days, hurricane days, closure days, right? And in the north, snow days should not necessarily, bring a cessation to educational opportunity. It needs to be continuity. And that's a conversation we're having with our teacher partners in reaching the protocols for the continuity of learning, despite the isolation of that student as a result of COVID conditions.
That's great. All that technology to help us continue to move forward and not stall that learning process, because we know how important that is for our children, that continuity. Appreciate that. Talk to us quickly about extracurricular activities, after school athletics, that kind of things. Will we be seeing that this year?
Absolutely. So part of our protocols envision us resuming additional time on task, which is so key, particularly for some students. So this school year is going to be different from previous school years. Some students will go to school longer as a result of aftercare, which is academic in nature, but also in many cases, aftercare that is based on the arts, music, sports, etc. Physical activity and sports activities after school, after the last bell, will be a reality, but they will be controlled and guided by appropriate protocols, which insist on obviously social distancing. Volunteers and volunteer organizations will be able to come on campus following the strictest protocols for their involvement on campus, which will include obviously the wearing of masks. And we hope to provide as normal a school environment, inclusive of students participating in clubs, students participating in aftercare activities, and the involvement of not-for-profit entities that collaborate with us in terms of providing extension of academic programs, but also social emotional programs, also aftercare programs for students that bring the arts and music to the students. So there will be a little bit of everything for everyone. I think what we need to recognize is that the protocols, the protective and preventive protocols will be in place. And it is extremely important for everyone to actually follow them so that we don't have a relapse that takes it back to where we were, months ago in terms of entire schools being shut down. That's not something we want. And I think that carries a great deal of personal and collective responsibility on the part of our workforce, on the part of visitors, on the part of partner entities, as well as our own students.
That's great. Superintendent Carvalho, this is so good, so important, the information that you're giving us, and it's such a hot topic as well, and we are just getting loads of questions. I wish that we could cover them all. I think we're going to have some listeners who are frustrated they didn't get their questions answered. We just don't have the time to get to all of them tonight, but I would love if you would just lead us, and we've got to step out. We've got two other guests as well, but if you would just leave our parents with any, word of encouragement, or, as the leader of our entire
Sure.
district, just a word of encouragement for this upcoming year.
Certainly, Sierra, and thank you so much. And I've been monitoring the chat to a certain extent. I want to say a couple of things. Number one, we are working and educating in an environment that's highly regulated at this point by political entities that I have some concerns about their ability to guide us through what's the best interest of students, considering the health risks that are present. Yeah, with that said, we're going to make the most of this school year. And we've learned a number of things. Number one, there are a lot of students who have been left behind, who have lost a lot of academic ground, who experienced a great deal of unfinished learning. And we have a moral and professional responsibility of catching them up. That's going to be our focus. Second thing, we're going to insist on following the science as we finish the last of the protocols, including the issue of masks in schools, appropriate contact tracing, and quarantining. We cannot compromise on that. Thirdly, in as much as we want to have physically protective environments that are stimulating and they are intellectually nurturing to our students, we're going to emphasize on the social, emotional, and mental health services to our kids. So every single school will have a medically trained professional, a nurse, et cetera. Every single school is going to see an increase in counselors, mental health coordinators, in psychologists, social workers, because we know where our students' current condition is and where it needs to be. And the last thing I will tell parents is, look, in as much as we can anticipate and put in place protocols that are important, we cannot anticipate every single variation or variant or its impact of this virus. So some degree of patience and understanding will be required. We will continue to be a system that is guided by science. And I will not abdicate that promise or that premise. So with that said, I am looking forward to welcoming 350,000 kids, to welcoming close to 20,000 teachers, and reawaken this sleeping giant from the summer nap that we call Miami-Dade County Public Schools. It's a great time of the year, and we're going to make the most of it. And we will continue to be that A school system we've been for the past 3 years, a system with 0 F-rated schools, and as of this year, for the first time, 0 D-rated schools. 100% of our schools are A, B, and C. That's our commitment. That's my promise. And as I said, I look forward to a fantastic school year, one that's going to be difficult, nonetheless, but one that's going to be amazing in terms of the opportunities that we'll realize for our children. And thank you again to Jackson, to UM, to all of our critically important partners in delivering so much to our school system via the partnerships that we have in place with all of you. And lastly, to the medical presence and the medical advice and science that's being provided to our community, both in terms of reports, in terms of assistance, but also in terms of returning reason to what's always been reasonable, which is doctor knows best. And I take comfort in that. So thank you so much for the opportunity. And I really appreciate the time that you have extended to me today.
Yes, Superintendent Carvalho, thank you so much. And you're always welcome here with UHealth Jackson. You're always welcome at Miami Mom Collective. I wish we could do this again for 2 hours and get all the questions answered, but we're going to shift gears now and hear from our medical experts, because doctors know the best, right? So that's a great transition. Thank you again, and wishing you a wonderful school year as you lead us. Those of you who have joined us before, so stay with us, because now we're going to dive into some of your medical questions. Again, great interaction. Love seeing the interaction in the chat and the question box. I am doing my best to keep these questions moving. So drop those in the box as you can, and we will do our best. We end here like right around 9, so stay with us. But really, Dr. Chitani, who's been with us before, needs no introduction. He has been with us at least half a dozen times. He is the Assistant Professor of Clinical Pediatrics at the University of Miami Miller School of Medicine in the Division of Pediatric Infectious Disease. So this is his sweet spot. He is also does fellowship training in the program there at University of Miami. He is a published researcher, a number of other things. We're so thankful you're here. I don't mean to cut your bio short, but let's get into the questions, right?
Let's get into it. Thank you for having me.
Thanks for being here. And also, Dr. Lisa Gwynn, thank you for joining us tonight. This is your first time with us, and we're excited to have you. Not only does she serve as the Associate Professor of Clinical Pediatrics and Public Health Sciences at the University of Miami School of Medicine, she's also the Interim Director, Interim Division Chief of Child and Adolescent Health. So right here, what we're talking about tonight, our children going to school. She's also, in her free time, I don't know how you do it all. Teach me your secret. But she's also the medical director for the Pediatric Mobile Clinic, which Superintendent Carvalho alluded to. It's a program that provides a medical home to uninsured children, as well as the program director for the School Health Initiative. So 9 pediatric clinics in Miami-Dade schools. So amazing. In addition to that, she is leading testing. She's tested, her group has tested over 15,000 children in Miami-Dade County, and she is a board certified in pediatrics, a fellow of the American Academy of Pediatrics, as well as the lead president of the Florida chapter of the Academy of Pediatrics. So thank you for serving our community. Again, there's no one more qualified in this group right here than you two. So I'm excited to dive into some great questions. And those of you who are listening, feel free to drop them in the box when you can, and we will do our best to get to all of those. But lots of questions on the term of what Superintendent Carvalho was speaking about. Let's dive into all of that in just a minute, but first talk about how do we just get our kids back into a routine for school, and then we're going to get into virtual and masks and all that good stuff.
I guess I could take that first one. Thank you for having me. It's just really a thrill to be here. So I mean, every summer we go through getting our kids back into a routine, right? So, this pandemic, there are some kids that haven't been back to in-person school in over 1.5 years. So it is going to be more challenging to get them back on a routine. And I guess it's age appropriate. I think we're going to have a harder time with our teens with that, especially with their screen time and their really altered sleep-wake cycles. So we are going to have to be more vigilant parents over the next couple of months. They're not going to be on autopilot. You're going to have to be, kind of making sure that they go to bed at a reasonable hour, they get up, they have their breakfast, they have, good nutrition. The other piece to this is, the routine of being able to get into a routine of talking to your children when they come home from school, and not just assuming that they're having a normal, typical day, because I don't think they're going to have a normal, typical day for a long time. So I think that should be also part of their regular routine, is to have those discussions with your kids, just to see how they're feeling and how they're doing.
That's great. Talk to us about virtual school is still an option for a lot of people. What should people consider when they're making that decision?
For sure, the decision has to come from the parent, obviously, and consider what they're able to do. The superintendent pointed out, for those parents that are able to do the work-home balance, it might be an option for them to have their kids at home and doing virtual school. And certainly there is some safety that is with that, but equally understanding that that's not available to some parents and households, so their kids will have to attend to school. I'm really reassured to hear all the amazing things that they're considering and doing in the schools to keep our kids safe.
That's right. They are taking good measures. Talk to us about when we're taking our kids to school or daycare, what questions should we be asking to make sure that they're in a safe situation?
I think that's a great question, especially in daycares and preschools. At least in the public school system, the protocols have been vetted and they're consistent, they're standardized. With different daycares, you're not really sure what you get. So you want to know what their protocols are for any child that has some type of a symptom. What is their quarantining guidelines? How long do sick children have to stay out? Making sure that they're following CDC guidelines. And of course, we can talk about the subject now, masking. Masks in 4-year-olds. 4-year-olds can wear masks. 3-year-olds, hopefully they can wear masks. The younger kids, it's more challenging. So they're going to have to do a better job at mitigation strategies within their setting, such as keeping the kids distanced. What are their routines with teaching the kids how to wash their hands? Where are they eating? It is going to be more challenging for preschool kids, definitely, for sure. And I don't know if Dr. Chitani, since he's an infectious disease specialist, if he wants to add anything to that.
It's definitely about those times when they congregate. So when you get more than 10 people in a particular space, you need to be more careful. And so asking what they're doing during those times. Eating is a big one. Bathroom break is a big one, because they're in small spaces where they can aerosolize the virus and transmit it. So ask those questions and make sure that your child is safe in those situations.
That's good. On the topic of masks, we have some parents asking, are there, should an 8-year-old or a 4-year-old wear an N95? Like, what is the best type of mask? What do you recommend for children?
So there were several studies at the beginning of the pandemic about this. First of all, masks are safe for all of your children. Let's just start there.
Let's get it out there.
It's very safe. The second thing is which mask are going to be most comfortable in, because something is going to be better than nothing. And what the studies show, and looking at different materials and looking at different combination of materials, really you want at least a 2-layer mask. If there are 2 layers there, cloth is fine, if that's what they're comfortable with. The N95, I mean, we wear it in the medical setting because we're in a very different situation with a lot of infected patients. But out at school, it's not necessarily going to be required that they go that far, because they can be a little bit more uncomfortable than just a regular cloth mask.
Yeah, I don't know that a kid would keep an N95 on all day. It's hard for us to do it.
So just to make sure that I'm clear, you recommend that kids wear masks indoors, correct?
Yes.
100%. Mask up.
Yes, it needs to cover their nose and their mouth, both.
None of this. None of this.
None of that. It doesn't work.
Also, and sometimes I just want to cover their mouths because they talk so much, right? No, I'm teasing. I love my kids.
I have a 5-year-old daughter. I know. Oh my God.
No, I'm teasing. Talk to us about, it's easy to say, okay, everyone should mask up. But in reality, there are families with children who have special needs, who have sensory issues. We cannot dismiss those families. We cannot dismiss those children and say, you need to put a mask on your child. Talk to us about that. Talk to us about how we encourage not only these children, but these families who are doing just their very best.
That is such a good question. And we understand, I mean, we have these discussions in our offices with parents. Not all of our patients, are healthy and don't have any chronic health conditions or breathing problems. So we've had all of these varied discussions with our patients. First and foremost, I think it's crucial that you talk to your pediatrician about what's best for your child. Okay, your pediatrician is really your best source of information. There are no studies out that suggest that mask wearing in kids with sensory issues or breathing problems should be prohibited from wearing masks. And, I have to say that we've been in this pandemic for a year and a half now. And if your child hasn't worn a mask yet, then they probably, because they can't wear one, they probably shouldn't be in school, in-person school, just for their own protection at this point. So, to get kids to acclimate to masks, hopefully you've already had some trials with that if they haven't worn them already. But in terms of sensory issues, work with their occupational therapists and their physical therapists and talk to your doctor. And, that's the best advice that we can that we can give. There's no one size fits all with this situation.
Right. And I know we're going to talk about it in a little bit, but we are in a different area. Where we have Delta variant that is acting different than the Alpha that we originally had. And so we can certainly answer questions about that as well. But it's good. I completely agree. We're going to need masks. And if your child absolutely cannot, you've talked to your doctor, your pediatrician about it, and they're like, no, this just really isn't going to work for your child. Again, in person, those congregated settings may be too high of a risk. And so that's why the virtual setting is so great that it's being offered, and they can still be engaged in school, even though they have those conditions that prohibit otherwise.
And it is a risk benefit balance. Is the risk too high for your child to be in a classroom unmasked in a situation where we have a very virulent virus circulating? Or is the risk is less having them at home? So again, that's a choice that you have to make for your child. And so it isn't just a conversation about wearing a mask or not wearing a mask. It's how safe is my child?
Right. On that note, so many questions are coming in and they're all really good. I want to get to them all. So I'm going to be kind of fast. Please answer thoroughly, but the more we can get more in. On the note of masks, talk about face shields. Is it helpful in addition to a mask? Is it helpful alone? Talk to us about face shields.
So the percentage of which you can contract the virus through your eyes is actually rather small. Is it additive? Sure, it's great. Any added layer of barrier can add your protection, but the mask is going to be your primary mode, and distancing are going to be your top two primary ways that you can reduce transmission. It's keeping that 3 to 6 feet, and then keeping that mask in place.
Thank you.
Yeah, and a shield should not take the place of a mask. If you're going to wear a shield, the mask has to still be worn.
Gotcha. So not effective alone. Good in addition to. Talk to us about, man, there's so much. And there's a lot of families who may choose to go virtual. There's a lot of families who don't even have that option. So can you provide just some reassurance, some encouragement to parents who really have no choice but to send their kids in person? What would you tell that parent if you were sending your child in and that was the choice you had to make? How do you give them some encouragement for doing that?
Well, the strategies that we've said all along, if you can maximize and comply with those strategies, I think that's the best chance that you have to keep your child safe. And that's number one, wearing a mask. Number two, if your child is eligible to get vaccinated, have them vaccinated. And number three, make sure that they do their best to wash their hands and keep their distance. And I know that's challenging, but that's really all we have to go by right now.
Yeah, for sure.
Good. Talk to us about what activities, sports, clubs, we heard about all that's going to be happening, after school activities. Which activities should our children stay away from once schools open up? Is there anything you recommend?
Stay away from, you have to just consider each activity in and of itself. If it's highly congregated and they're not distancing, not able to wear a mask because it's physically taxing, that might not be the best activity to participate in. If it's activity that they're able to be distanced without a mask, but still be physically active, but have that distance there, then at least they have that barrier to, especially in the open space. If it's in a closed space, that's higher risk. So with each thing that we keep talking about, you have to take that risk with what the benefit is of participating in that particular activity.
And I want to just add, for the high school kids that play serious sports, the serious athletes, for many kids, especially in underserved communities, this is a big deal for them, to be able to play and participate. And so there's your real, for those populations, that's even more important to get vaccinated, to provide as much protection as possible. I do know that, it varies school by school. Some athletic coaches do a much better job than others in terms of having their players practice in cohorts and do their best to keep them distanced, keep them out of the locker room and close, quarters. So the athletic departments are trying to do the best that they can. When they're actually playing out in the field, there's very low risk for transmission. So kids that have been sedentary for a long time, we do want to encourage them to get out there and play and run and be outdoors. But as Dr. Chitani said, there are risks involved with, certain activities that people are close to. We call them the high risk, like the wrestling and basketball and football. So, I think it's going to be a balance of what they can do without wearing a mask and what they can't do.
Right. Great. Thank you. Okay. We're going to dive in now to Delta variant. Got lots of questions about the vaccine. Let's just start in general. Talk to us about the Delta variant. we're scared because we don't understand, we don't know. Talk to us parents, give us your medical wisdom. And how is this going to affect going back to school?
So the Delta variant is a much more transmissible virus than what we experienced before. And that's just the honest truth. When we initially had the Alpha variant, the very first one that made the scene, we saw, okay, this is as transmissible as measles, as many of the things that we had before, where we could take some precautions and really make a large impact. For the Delta variant, it's going to require a few more stricter guidelines in making sure that we're safe because it's so much more transmittable. We're talking about a twofold, fourfold more transmittable in the way that it takes. The other thing that we're seeing is that it's more virulent, meaning that it's causing more disease than what the Alpha variant was having, even in children. I know when we initially started this whole thing, we were saying, oh, we see kids are sometimes getting it and they're not getting as sick. The Delta variant is acting different. And so we have to take that into account and making sure that we do everything that we can to keep our kids safe from getting it because they can get sick.
Dr. Chitani, I want to ask you a question specifically. We have been doing this, together now for months, a year or more. And I remember our very first one, and we were kind of asking all the questions about, well, tell us about the MISC and these different things. And over time, we've learned more. And I know you're in research. Talk to us about, we're getting parents who are asking questions about the heart issue that they're seeing in young men, as a result of the vaccine or, whatnot. Can we talk now about vaccine? Lots of questions about that. I'll let you just initiate, take the floor, and then we'll get more specific from there. But will you talk to us about that?
For sure. So we know that there are several products that are available to everybody. Pfizer is a major player for our children because it's approved down to 12 years old. It's incredibly safe. And I do want to reassure parents of how safe it is considering how many millions of kids have received it. Now, when you start vaccinating at that level of how many people are getting it at one time, you start seeing some more of the rare side effects that can occur. One of those rare side effects is the heart condition that we're talking about. That heart condition is transient and treatable, meaning that we can reverse it and you will walk away with immunity against the coronavirus. So it's important to point out how rare that is and that we can address it easily. The other thing about I know there's a lot of talk about whether or not the vaccine is going to still be good against the new variant and how we're pointing out how different it is. It still has efficacy and good efficacy against the Delta variant. The difference is that we need to get enough people vaccinated so that we can create that barrier, especially for the younger children that can't get vaccinated. So any teachers on the call that can get vaccinated, I highly encourage you to get vaccinated. Share that with it, be proud of it so that your parents can feel more comfortable that their child is going to be in your room. And if I could, adolescents on the call, please get vaccinated so that you can also provide that barrier to those at home that are ill, those at home that can't get vaccinated. It's really the best way.
And I just, I'm sorry, my mind just went blank.
That's all right.
Oh, I know what I was going to say. Sorry. So the other thing to this that is important for everybody to understand is that the more the virus can mutate and spread and live in humans, the potential that it could get worse. So that is, like, from a public health perspective, something that's very, very important, and why we all have to be in this fight together, because these variants, and Dr. Chitani, this is his expertise, these variants will just keep on mutating. Sometimes viruses burn themselves out, but this virus doesn't seem to be doing that yet. So that's another reason for us all as humanity goes, that we really need to vaccinate everybody so that we can stop this deadly virus.
Right. So some important facts about getting vaccinated. So you get vaccinated, right? And say you still get infected, because we are seeing that sometimes happening. When they compared a person that gets infected and a child that is not vaccinated versus vaccinated, they both get infected. the person that is vaccinated has less than half the amount of virus in their bloodstream compared to the person that was unvaccinated. There's just no buffer in that person that gets infected with no vaccine present to help them fight it off. So there's so many benefits that I could list out for you for what a vaccine can provide your child if they're eligible. And hopefully soon, and I'm sure this is a question, we'll see the age limit actually go down further, and that'll be even more of a push to get more and more kids vaccinated against coronavirus.
So if I can just, because I'm seeing a lot of activity in the, that's why I'm getting a little distracted, but there's some questions about the vaccine and long-term effects from the vaccine. And what we do know in the 70 years or plus years that we've been vaccinating is that the long-term effects happen within the first month after administration. So we see, first of all, we'll see immediate effects, you know, in rare cases, anaphylaxis, where, you know, you have a severe allergic reaction. And then with a couple of weeks into it, some people will, and this is in adults and children, come down with a neurologic condition called, oh my goodness, my mind just went blank, Guillain-Barré syndrome. Okay, I'm sorry, it's been a long day. So they can get Guillain-Barré, which is kind of a condition where you become temporarily paralyzed. Sometimes it can be permanent. These cases, these instances are extremely rare. Most of the time, it's a minor allergic reaction, and it's not from the actual antigen, if you will. It's from the ingredients that we use to mix the vaccine. So it's the components within the vaccine that people become allergic to. So when people are saying, you know, I want to wait and see what happens, the long-term side effects, that isn't the case. In our, you know, 7 decades of vaccinating, you know, and coming up with new vaccines, we know so much that the long-term effects we're not going to see. And yes, it is a new type of technology, but it's not really that different, because yes, this is a messenger RNA technology, but we've been doing DNA technology now for 70 years. So it's not really that different. And then in the clinical trials, they've been extremely safe and well tolerated.
So much information here, man, and so many questions. I'm like, wish we could get all, I'm going as fast as I can. Everyone who's submitting questions, thank you. I'm doing my very best. Let's talk about, when will the vaccine be available for kids under 12? And Dr. Chitani, I think in the past you shared with us how the vaccines are developed and tested on different age groups. So maybe you can give us a blitz version of that, and what your 2 cents is for when it will be available for kids under 12.
For sure. So the vaccine goes through several phases, and it's beyond phase 3 now. So we're well into beyond human trials where it's been deemed safe and effective. The efficacy, although we look at that for a longer period of time so that you can see how long it lasts for and how good it lasts for, which actually the studies have been looking remarkable for the longitudinal aspect of how long you have immunity for. For children, though, remember, there are a lot of adults in the United States, and it's very easy to enroll an adult into a trial to say, hey, I want you to try this out. Do I have your consent? Yes, I have your consent. And here we go, 1 million people vaccinated, and we can look and observe how it reacts in them. In children, the younger you get, the smaller the group is. And there are some children that should not be enrolled into these type of studies, and they're not. So it even makes the numbers even smaller. So because we really have to wait for those children to be of age and to be safe to be able to be enrolled in these studies, we're waiting for that data to come up. Now, there are projections talking about October to December is kind of the range that we're hearing right now in the chat with infectious disease specialists. We're just holding our breath for a lot of that preliminary data to come out. I can speak to the preliminary data shared within our groups, looks very promising, that it's very safe. And once we prove that safety, it'll be released, and we'll be here ready and able to vaccinate those kids. But also, just to point out, as we're talking about this vaccine, the childhood vaccines that we've been giving for the 7 decades are still very important. I don't think anybody wants an outbreak of measles in the middle of the Delta variant. So we don't need multiple outbreaks of things right now. We can't, the health system can only take so much. So please make sure your child is vaccinated against the things that are already recommended for school entry. And then we can talk about the COVID vaccine as well.
That's right. Stay up to date on those forms. With the stress that's happening on the hospitals in Miami-Dade, you know, we hear about things in the news. Are we prepared if there is an outbreak when school begins?
Yeah, we're prepared. I can tell you that I sit on quite a few number of committees that look through, okay, what is our stocks of everything that we need for personal protective equipment, for medications, for everything. I review so many, there's a new medication like every other month that we're like, okay, so that's gonna be the 6th alternate to the primary medicine that we know that works right now in children. And so we're ready. We are primed and ready. Do we want it to happen? No. And that's why we're having this webinar, so that we can prevent as many infections as possible. Prevention is key. Afterwards, yes, come to your doctor. We're ready to help you and keep you safe.
Great, thank you. I notice our time and we've gone over already, but there's still so many questions. I want to respect you, Dr. Chitani and Dr. Gwen. Would you be willing to give us 6 to 8 more minutes so we can go through a few more? Thank you
let's
for
do it.
all of
Sure, let's do it.
Okay, this is lightning round. How about it?
Let's
talk about, we talked about Delta variant being very transmissible. Is it, you know, it's equally as transmissible outdoors? Obviously, maybe outdoors is better than indoors, but it's still transmissible outdoors, correct?
It's still transmissible outdoors, but the open space doesn't allow for as much transmission as when you're in an enclosed space.
And we have learned that it is more transmitted more through respiratory droplets as opposed to living on surfaces. Right. So if that means anything.
We don't have to wipe our Amazon boxes down with Clorox wipes anymore. So that's
no, just wash your hands.
Wash your hands, right.
Learn that. Wash your hands. Wash your hands. What about circling back to the vaccine? We've had some questions. If someone has had COVID and they've recovered, thankfully, is that immunity that they have enough?
Excellent question. And the answer is no, because you form different immunity from the natural disease when you actually have COVID compared to getting the vaccine. And actually, the immunity from the vaccine, the immunity that you gather from the vaccine helps with more variants than what we found with the natural immunity. Natural immunity, you're good against that one variant. Well, guess what? Another variant will come along and infect you, and you'll get COVID all over again. There's also a study that was really exciting that in those people that had COVID and then they waited the appropriate time period and then got vaccinated, they have some of the most robust immunity compared to other people. I'm not advocating for you to go get COVID and then vaccinate it. But in those instances, that's why we're still recommending for everyone, even if you've had COVID, to go get vaccinated.
Excellent.
Great. Well, thank you for that. Okay, lightning round, we keep them coming. What is your recommendation for how long children should be out of school if they do test positive for COVID-19?
Oh, that is a changing question. I have to say, the Delta variant is acting differently. The duration that we shed the virus is actually longer than what we saw originally. Right now, by the CDC, we're set at 10 days. So 10 days should be the period right now. That recommendation may change. I have to put that caveat.
And it will change. Our school district will, continue to monitor the situation and go by the CDC recommendations. Right now, it's a 10-day quarantine period.
Okay, great, thank you. Let's talk about boosters for vaccines for adults. We also know that there are some vaccines where you get a 2-dose situation. What is someone's two-part question? So one, talk about boosters, and then second is what is someone's, I guess, percentage of protection if they only have 1 dose of a 2-dose vaccine?
Okay. So boosters we haven't heard about yet, but because the studies have been looking so good that immunity is maintained. I mean, they've studied outwards of 6 months and it's still pretty good. That recommendation hasn't been supported yet. As far as how much immunity you have after 1 shot, there's a lot of statistics in that question, but more so that you have some protection. I think there's a number of like 60%.
60%, yeah, that's what I've heard.
Can actually respond to it. And if you are part of that 60%, that's still not even as good as when you get the second booster, because the 60% will only have like 80% protection, let's say. Then once you get the second shot, then you're at 90% of people, 99% of people will respond to that, and they will have the 99% protection. And you should want 99% protection. That sounds much better than 60, 80 type of chances.
And
Right.
just remember that these booster shots that they're talking about now in the news is for adults, and it's for adults with significant immunocompromised conditions.
Okay, great. This information is so helpful. Talk to us about what if you contract COVID, like say tomorrow I test positive, hope not. And then I'm like, I want the vaccine. Like, can you get it the same day? Can you get it? What's the period of, can you get it after having COVID?
The last thing that I read was that it was 28 days that you had to wait between your positive PCR, your positive test from the nose, to when you should be recommended to get the vaccine. That can differ because if you have an immunocompromised age, you have some underlying condition, it may be longer. So I just recommend generally talk to your doctor, talk to your pediatrician so that they can guide you how long you should really wait.
Yeah, I mean, usually you have to be completely without symptoms. So that's, usually by 14 days, you're starting to be in the clear, but just to be safe, giving it another week or two isn't going to hurt you.
Yeah, that also changes if you get COVID and you have to go to the hospital and get medications against COVID. That makes it even longer that you have to wait. So there are a lot of situations I can put in there. So I just have your records and talk to your doctor so that they can guide you. If they have questions or they're not sure, you can consult me. I am here, I have a clinic, and I can certainly see anybody that needs that guidance for these types of situations.
Definitely. Okay, just a few more. Is it true that vaccinated someone who gets COVID can still spread it to those who are unvaccinated or vaccinated?
Yes.
That is true. The vaccine has a lot of number of benefits. The amount of time that it can actually reduce the times you get infected. So there are 3 different things that I want to talk about. Yes, you can be infected, but you may not develop disease, meaning you may not have symptoms. You could get infected, develop disease, and then be hospitalized. So when they look at all these studies, they look at, okay, you were vaccinated and you got infected. Did you need to be hospitalized? Did you actually develop symptoms? Okay. And with each of those categories I pointed out, the number gets smaller and smaller and smaller. So if you've been vaccinated, the rate to which you're hospitalized is like less than 0.01%. It's really, really tiny for those individuals, but you can still spread it. So each of those conditions that I spoke about, you can still shed the virus and spread it.
And I want to add that kids more often than not aren't necessarily, they're infected, but they're asymptomatic. They're not showing symptoms. So that's another important reason why we should, encourage our kids to wear masks, because we just don't know if their friends that they're interacting with, if they have no symptoms, nobody is going to suspect that they in fact are shedding the virus.
Right. But if they do have symptoms, keep them out of school, please. This is the time for our community to come together. It is our community. We take ownership and responsibility for keeping it healthy. The only way we can really do that is that if your child is sick, they got to stay out of school.
Yeah. Please, parents, let's be diligent about that. Even down to the cold, the green nose, the non-COVID issues too. We have to do our part. It's a challenge. Parenting is hard. We all know. And by God's grace, He's put us as parents to our children. And I've heard both of you say this, and Superintendent Carvalho as well, that we have to do that cost benefit analysis for our families. And we got to use wisdom. And this is why we're hosting events like this, to get educational wisdom, to get medical wisdom, so that you as parents can be informed to make the decisions that will serve your family and, serve and bless our community as well. Okay. I'm sorry to our viewers who are still sitting there going, but I'm one of 45 questions. I wish we could get to all of them. We would be here all night. And I would do it if we could, but we all have to get on with the evening. So Dr. Gwen, Dr. Chitani, thank you so much for your time. Again, Superintendent Carvalho, thankful for him, as well as Jackson, for putting this on tonight. And just want to end it with, how about tie a bow on it for us? Both of you would love to give you both a last word for just a charge to families as we're going back to school, and just people who just are still wrestling. Give us some information. Where should we look for resources? How can we continue to make these decisions in a wise way?
So last words is get vaccinated if you're eligible. Encourage your teens to get vaccinated. Reassure them that it's the right thing to do. Look here to the American Academy of Pediatrics. We're both proud members, and it's a great source of information. We do vet everything and make sure that it's the most up to date. So please take care.
And I echo that regarding the American Academy of Pediatrics. Parents can go to healthychildren.org. It is an amazing resource for parents, and it goes over all of these issues that we discussed. So I encourage you to go there. I also just want to say that, as Dr. Chitani said, we're in this together, and you know, kids emulate what we do and how we act. And so it's time for all of us to come together and do the right thing and do what's best for our kids so that they could grow up to be, you know, caring and responsible and healthy.
Thank you so much. Thank you, both of you. I do want to draw your attention, those of you who are listening in. The fun doesn't stop here. We continue to do these, lots of different topics. I feel certain COVID's going to make its way around again because there's just a lot we didn't even get to cover. But we already have scheduled 3 weeks from tonight, September 2nd. We're going to have a parental guidance episode on the topic of dogs and toddlers. So, you know, a lot of families have a dog and then they have a baby, and then you kind of have to think of all the things that go together with that. So safety and expectations, and how do you supervise the two together? So come and learn about that and bring your questions. Again, thank you so much to Jackson. You can go back and watch this episode. You can share it with friends, those in your community. If you're a teacher, you can share it with your homeroom class or the parents that you are dealing with. But you can go back to jacksonevents.org, and this one will be up early next week. But there's a whole library there of previous parental guidance webinars on topics, everything from COVID to swim safety to autism, the whole gamut. So you can find those resources there. Again, I'm Sierra with Miami Mom Collective. If we can ever serve you, you can find us on all the social channels and online at miamimomcollective.com. Thank you again to the team at Jackson, and we hope you all have a wonderful evening, and we wish you all the best as you head back to school, whatever that looks like for you and your family. And we do just wish you all the best, and we're here to encourage you and equip you and empower you to have a great year. So thank you, everyone. Have a good evening.